Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. We're in August, which means it's National Prostate Cancer Awareness Month. And to talk a whole bunch about the signs and symptoms and what you need to know is Dr. Dr Saux, medical oncologist with North Shore Oncology Associates. Dr. Saux, thanks for being here today.
Thank you for having me.
You know, and one thing real quick I want to throw in there is congratulations again on being named one of the North Shore's best when it comes to oncology. So
thanks a lot.
We got a double duty here. With Prostate Cancer Awareness Month, of course, we want to get the facts out there. And if you could kind of give us a real quick rundown of some of the important things people need to know about prostate cancer.
Prostate cancer occurs in men over 50. Very rare to be under 50, and average age is in the mid-60s. There are a few symptoms to kind of be aware of, and that's changes in your urinary stream and difficulty urinating, frequent urination at night, erectile problems, and blood in your urine. If any of these things start to occur, you should follow up with your primary care doctor or urologist.
Right. Now, what are some of the risk factors in terms of hereditary factors and whatnot that may lead to prostate cancer?
Prostate cancer seems to run in families, but we don't have a definite genetic link. It's more common in African Americans and less common in Hispanics and Asians. It's the second leading cause of death from cancer in men in the United States.
And it seems to be becoming more and more common. I hear more and more cases of prostate cancer out there. Is that the case?
I think it's probably a result of the screening that we're doing now, and we're picking up cases earlier. So there's more, the number is increasing.
Right. What, you know, if somebody out there is watching and they are over 50, what are some of the concerns that you hear from patients when they come to you? What are some of the common questions that they have?
Well, by the time patients see me for prostate cancer, usually further along. Mm-hmm. But in general, men are concerned at age 50, they know that they should go and have a prostate exam by a urologist when they turn 50, and then yearly after that. Concerns about how aggressive a prostate cancer might be are also raised sometimes, but most prostate cancers are pretty slow growing. There are aggressive forms, but really early detection is the key to beating this.
Now, and prostate cancer is it easily treatable?
Initially, prostate cancer is treated with a combination of surgery and radiation, and there's several different types of radiation delivery systems that are used. Prostate cancer is then treated, if it's not completely eradicated with those procedures, with hormone manipulation. After a period of time, if hormone manipulation fails, then chemotherapy and some new targeted drugs for advanced prostate cancer are used.
Okay. Can you walk us through a couple of those radiation therapies that you were talking about?
They have external beam radiation where the radiation is delivered through the body, and then they have radiation seeds that are implanted by the surgeon into the prostate. And then they also have a different therapy, brachytherapy, where other radioactive rods are placed in the prostate for treatment.
Okay. You talked a little bit about screenings, and screenings with any cancer are always important. What is the success rate in treating prostate cancer if you find it in a screening?
If you find it early, and depending on the grade of the cancer, it can be very good. It's very complicated the way that prostate cancer is graded, and so to give a blanket statement of early detection is going to lead to a cure is inaccurate. Right. But it does definitely improve the prognosis.
What is prostate cancer? We talked about it being pretty prevalent. It's the second highest cancer out there, second deadliest cancer out there. How big of a problem is it in St. Tammany Parish?
It's common, and as the population of the parish ages, we're going to see it more. Right. In general, St. Tammany Parish has been a relatively young parish, but the population is aging, and we're going to start to see more more incidence of it.
So it's important to get those screenings. You turn 50, make sure you go in to see your physician. Any of those warning signs, make sure you get it checked out as soon as possible.
Absolutely.